Members, I think at this point most of us know which way we're going to vote on this monumental piece of legislation, so I'm just going to be brief and make just a few remarks, a few concerns that I have. I agree with Representative Collins' statement earlier that, we've been handed a box that we're stuck in. We may not like the box, we may not like the way the box has been constructed, but we've still been handed this box. And my concern is that if we go forward with this, we're going to end up building our own box, trying to fix the box that we were given. And what do I mean by that? If we go forward with this private option, we are going to set a certain amount of expectations among the citizens of our state that this private insurance is always going to be there. And sure, there is a clause in 3 years we can decide to come out, but I think it was Ronald Reagan that said it best, there's nothing more permanent than a temporary government solution, something along those lines. And I fear we may end up doing that even though we've got good intentions here. The other concern that I'm going to raise is in this piece of legislation, I fear in the end, even though this is a good debate to be having, I fear in the end it may all be for naught, because there are several good triggers put in this piece of legislation. We are once again dependent on Washington to agree to our terms as if we're in a position of authority here. But I believe that position is simply an illusion. If I was a betting man on this, and I don't know how many of you in this chamber are involved in betting, but how many of you in this chamber would be willing to bet your hard-earned money that Washington is going to agree to all those expectations that we've laid out? I don't hold high hopes for it. So what's the answer? Well, I believe the answer is some of the things that we've kind of looked at. The answer is not creating bigger government, more programs. The answer is trying to empower our local communities to be able to help their citizens. During this last session, during the interim, we had the opportunity to visit one of the community health centers out in Helena, West Helena, a local program where they're going out proactively, door to door, seeking out citizens who need help. They are holding classes to teach citizens how to be better stewards, how to have better health. I believe that is the proper direction we need to take our health care instead of trying to grow yet more and more government, trying to dictate from the top. The answer is not dictating from the top. It's trying to support the local level initiatives. And with that, I would appreciate a no vote.